The Public Health Agency of Canada is partnering with Canvax to produce a series of webinar shorts for healthcare providers. These are pre-recorded videos in a format that is quick and digestible in order to fit into your busy schedules. Today's webinar short will be presented in a case-based format that will support healthcare providers in implementing the recommendations of the National Advisory Committee on Immunization. We value your feedback and use information collected to inform us on future webinar products. Please take 2 minutes after this webinar to complete the evaluation survey. The link can be found in the description on the YouTube page and on the canvax.ca website. A copy of the presentation will be made available on the canvax.ca website as well. On to today's presentation. I would like to welcome Catherine Langlois, a registered nurse with the Public Health Agency of Canada, to present on today's topic. Over to you, Catherine.
Welcome to this short webinar from the Public Health Agency of Canada on the updated National Advisory Committee on Immunization recommendations on COVID-19 vaccine doses for immunocompromised individuals. The hyperlinks you will see in this presentation are included in the downloadable PDF document that is posted together with this recording on canvax.ca. At the end of this webinar, you will be able to identify who should receive an additional dose based on the recommendations of the National Advisory Committee on Immunization, otherwise known as NACI. You will also be able to discuss with patients the potential impact of an additional dose on their level of protection. This short webinar is designed to help you, the healthcare providers, implement NACI's recommendations. On September 10th, 2021, NACI recommended moderately to severely immunocompromised individuals should be offered an additional dose of an authorized mRNA COVID-19 vaccine following a 1 or 2 dose complete primary series. To learn more about the evidence and rationale for these recommendations, please see NACI's rapid response statement. Scientific evidence tells us that the general population develops a robust immune response to a complete series of COVID-19 vaccines. The difference for immune-compromised individuals is that they have a weakened immune system, which can be caused by either a disease or a medical treatment. Right now, evidence shows that on average, immune-compromised individuals have lower immune responses to the standard primary series of COVID-19 vaccines compared to what we observe in the general population. Recent studies also show that some of these individuals can mount a stronger immune response by receiving an additional dose of an mRNA vaccine. As such, NACI recommends that people who are moderately to severely immunocompromised should get an additional dose of an mRNA vaccine following their primary series. Before we get started on the recommendations regarding additional doses of COVID-19 vaccines, let's have a closer look at the difference between an additional dose and a booster dose. We know that moderately to severely immune-compromised individuals may have a lower immune response to COVID-19 vaccines compared to the general population. An additional dose provides them with another opportunity to develop a better immune response and help them establish an adequate level of protection. A booster dose is different from an additional dose. The general population develops a robust immune response to COVID-19 vaccines, but protection may decrease over time. A booster dose is used to restore protection that may have decreased over time. We acknowledge that at present there is scientific debate about whether a third dose of a COVID-19 vaccine truly constitutes a booster dose in the traditional sense. However, for the time being, additional doses of COVID-19 vaccines following a complete authorized series in populations that are not immune-compromised are being described as booster doses. Over time, what defines an optimal primary series for COVID-19 vaccines may evolve and be refined. It is important to define who is considered to be moderately to severely immune-compromised according to the NACI statement. These include people with medical conditions or receiving treatments, such as active treatment for solid tumor or hematologic malignancies, solid organ transplant and taking immunosuppressive therapy, chimeric antigen receptor T-cell therapy, or hematopoietic stem cell transplant within 2 years of transplantation or taking immunosuppression therapy. Those with a moderate to severe primary immunodeficiency, for example, with DeGeorge or Wiskott-Aldrich syndromes, individuals with stage 3 or advanced untreated HIV infection, and those with AIDS. While we know that HIV attacks and destroys the infection-fighting CD4 cells of the immune system, individuals in early stages or undergoing treatment are expected to mount an adequate immune response to COVID-19 vaccines. Without treatment, HIV infection advances in stages. The CD4 lymphocyte count is an important marker used to assess immune system function and the stage of disease. At stage 3 of HIV, the CD4 count goes below 200 and the immune system is considered to be severely compromised. Finally, the moderately to severely immunocompromised individuals include those who receive the following active immunosuppressive treatment: anti-B cell therapies, high-dose systemic corticosteroids, alkylating agents, antimetabolites, TNF inhibitors, and other biologic agents that are significantly immunosuppressive. We've now reached the scenario portion of the webinar. 3 scenarios are presented today. Note that this webinar is based on the NACI recommendations that were valid as of September 10th, 2021, with regards to the additional dose for immunocompromised individuals. Keep in mind that the eligibility for additional doses and for booster doses is determined by provincial and territorial jurisdictions. The eligibility or recommendations that are currently in place in your jurisdiction may differ from NACI recommendations. Since recommendations continue to evolve and vary by jurisdiction, we invite you to visit the NACI webpage and resources from your jurisdiction for the latest recommendations. Our first scenario is about Avery, who is 32 years old. They received a solid organ transplant 6 years ago. They're otherwise in quite good health. They take immunosuppressive therapy due to their transplant history. Is an additional dose recommended for Avery? An additional dose of COVID-19 vaccine is recommended as they have a history of solid organ transplant and receive an immunosuppressive therapy. You can also advise them that an additional dose may help improve their immune response. Even after the additional dose, they may still be less protected than someone who is not immunocompromised and who has received a complete vaccine series. They should continue to use caution and encourage those around them to be vaccinated. The second scenario features Andre, who is 42 years old and who is living with HIV. He is currently on antiretroviral medications and has an undetectable viral load, normal CD4 count. Is an additional dose recommended in his case? Andre is not considered to be moderately or severely immunocompromised. His viral load is undetectable and his CD4 count is normal. He does not have advanced untreated HIV or AIDS. We can therefore expect that his immune system would have developed a robust response to the primary vaccine series. An additional dose in his primary series is not recommended. Our next case, Marie, is 62 years old. She has type 2 diabetes, high blood pressure, and dementia. She seems to catch every bug and has been told by doctors in the past that she has a slightly weak immune system. Marie lives with her son, but due to her cognitive deterioration, she will likely be moving into long-term care in the coming year. Is an additional dose recommended for Marie? Marie is not considered to be moderately to severely immunocompromised. While Marie has underlying conditions, she does not have a medical condition or receive a treatment that is associated with a moderate to severe immune compromise. We can therefore expect that her immune system would have developed a robust response to the primary vaccine series. An additional dose in her primary series is not recommended. This concludes the scenarios on NACI recommendations regarding additional doses of COVID-19 vaccines in Canada. To remain up to date with the latest NACI recommendations and with the Canadian Immunization Guide, we invite you to subscribe to the notification emails by following the hyperlink and process from this slide. You can also access our healthcare provider toolkit for information on COVID-19 vaccines for healthcare providers. Finally, we invite you to continue to follow the Public Health Agency of Canada and its partners as we collaborate to deliver webinars on foundations and emerging topics related to COVID-19 vaccines and on NACI recommendation updates. Don't forget to let us know if you liked the short format of this webinar by completing the review survey, which is linked in the YouTube description of the recording. Thank you for taking the time to join us today. We wish you an excellent day.